Hi, my name is Sue Bishman. I'm an RN and have over 20 years experience in the long-term care industry as a supervisor, as a director of nursing, and as a licensed nursing home administrator. Currently, I am an associate in ministry in the Evangelical Lutheran Church in America. As part of my responsibilities, I provide spiritual care for people who are ill in the hospital and in extended care facilities. I would like to talk to you today about your responsibility as a caregiver in meeting the spiritual needs of those that you care for. There are two main concepts that we will be discussing today. Both are interrelated, but not the same. The first one is spirituality. Spirituality can be defined as a connection to or belief in a power outside oneself, a supreme being, often referred to as God. There are people who very much doubt the existence of such a being, and they are called agnostics. There are others who do not believe that such a being exists at all, and they are called atheists. We are going to primarily concentrate today on those who do believe and meeting their spiritual needs. The second concept that we need to define is religion. Religion is an organized set of beliefs. It is often the way that spirituality is put into practice or expressed. There are over 1,000 religions in the world. Religion can affect many habits of daily living. They can affect diet, what and when people eat. They can affect even medical treatment. There are some religions who do not allow, for instance, blood transfusions or even surgery. Religion is one way to understand the meaning of life. It can be a source of great strength and comfort and hope to people who are facing difficult situations. What then are your responsibilities as a caregiver to assist in meeting the spiritual needs of your patients? First of all, it's important to look for clues that could tell you of the importance of religion and spirituality to the person that you are caring for. You might observe a Holy Bible, which is central to the Christian faith, or the Holy Quran, which is the book of Islam. You might observe your patient holding a rosary, which is a string of prayer beads. And they might have it tucked in their pillow or on their bedside stand. They might be wearing a cross as a necklace or other jewelry. And there are many other kinds of religious jewelry that can be worn. Perhaps you see a statue of a saint on their dresser. St. Thomas, St. Matthew. There are emblems of the Jewish faith also. One of these would be a menorah, which is a candle holder used for religious ceremonies in the Jewish faith. It would not be unusual to see religious pictures or framed scripture verses hanging on the wall. And you might observe someone wearing special clothing. There are also signs that you can look for when you are caring for your patient. Perhaps they are saying prayers, especially before bedtime or before mealtime. They might be attending religious services, and you might observe that clergy are visiting them. You might see that they are watching religious TV programs. And if you see cards around their room, some of them may have a religious theme, religious pictures on them. I cannot stress enough that you must be respectful of a person's belief, even though that belief may be very different from your own. And never, ever try to convert anyone that you are caring for to your way of thinking. Please be mindful of the church services that are going on in your facility, the time and the place. And if your resident shows a desire to go to those services, please assist them to do so. You should also see to it that they are neat and clean and appropriately dressed. Many residents will want to wear their Sunday best, even though the service may not be being held on a Sunday. If anyone asks you, requests spiritual guidance, you must be sure to report that to your nursing supervisor. And be aware if there are any spiritual advisors available in your facility for those people who do not have one of their own. There are times when people might be going through spiritual distress. You could recognize this by several signs. One might be extreme agitation or fear of the future. You might hear people wanting to confess mistakes that they think they have made in the past, and they might be preoccupied with the fact that they think they're being punished for those mistakes, or they will be punished in the future. These are times when you absolutely want to get help for them, the spiritual support for them. Some people might be depressed about their condition. That is not unusual. Or they might be depressed about their inability to follow the dietary restrictions that is set forth by their religion. These also call for spiritual guidance. Anger at God because of their condition is a very, very common thing and will need the help of a spiritual advisor. You might find some people that you are caring for asking for communion, which is a sacred ritual of the Christian church. And they might also be asking to see clergy, their pastor, their priest, their rabbi, their shamus. Very important that you report these requests and that you see to it that they are carried through. If indeed a clergy person does come to visit, please provide privacy for that meeting. And in fact, you may take them to a chapel if there is such a place in your facility. Be sure if they are meeting in the room that both the resident and the room are neat and clean. If your facility allows, and if you feel comfortable, please read the Bible or other spiritual book to your resident if they request this. And you might also pray with them. I know that as a student nurse, I was practicing in a Catholic hospital, and although I was not Catholic myself, I could see how important praying the rosary was to the people I was caring for. And so I learned how to do that, and I did that with many of my patients. You might encourage people to talk about their beliefs if they are so inclined. Provide that listening ear for them. And don't forget the importance of touch to communicate that you accept them. Holding their hand or gently rubbing their arm can be a source of great comfort and reassurance to them. There are some situations that will require extra spiritual help. Facing life and death situations. Perhaps the family is not accepting of their condition, and this can create great tension. You might observe someone to be lonely and have few visitors. Perhaps they are facing surgery and are uncertain of the outcome. They have experienced a loss of limb or other body part. In every case where extra spiritual help is called upon, you need to know the resources that are available to you. Many facilities have a spiritual care coordinator that you can contact. Some of the larger facilities have a whole spiritual care department. Many have resident chaplains. In every case, you can always discuss the situation with social services, and certainly should do so with your supervising nurse. We have assembled a panel from different faith traditions who have agreed to talk with us about their faith. Please watch as they discuss how their spiritual needs can be met in a healthcare setting. Welcome, panel. It's nice to have you with us today. I would ask you please to introduce yourself and tell us which faith tradition you represent.
I'm Sadia and I'm representing Islamic tradition.
I'm Deborah and I'm Jewish and I'm representing the faith of Judaism.
I'm John and I'm representing the tradition of Christianity.
Panel, if you were in a healthcare facility, what would be the most important faith practices that you would want to observe in order for your spiritual needs to be met?
I would like to be able to pray 5 times a day, and in order to do that I need a clean place and a prayer rug where I can pray. And also I prefer that it's a quiet place where I'm praying.
A traditional Jew would pray 3 times a day. That person would need to face east and probably be praying in Hebrew. As a Jewish woman, I'd really want to be able to light candles on Friday night, which would be the beginning of our Sabbath, the Shabbat, and respect the Sabbath as a day of rest. It'd also be important for me to have the food I would need to continue in my faith practices, and this diet would include, or I should say exclude, pork and shellfish, and would have meat slaughtered in a kosher fashion. Those things would all be very important to me.
I think one of the things that happens to some folks as they move into a healthcare facility is that they lose a connection with their congregations and therefore their faith tradition. I would hope that the healthcare facility as well as congregations would work really hard to make sure that that connection doesn't get lost, that folks who are Lutheran or Catholic or Episcopal might be connected still with somebody of their own denomination.
Would you each finish this sentence in regards to your spiritual needs being met in a healthcare setting? I would be offended if.
Well, I would be offended if somebody through ignorance made fun of my tradition or denomination in some fashion. If I were Buddhist, a practicing Buddhist, somebody who would maybe make fun of my meditation, or if I were a Roman Catholic, somebody saying something to the effect, oh, that religion is all smells and bells. I think the roots of our faith, no matter what our tradition, they run very deep, and we really don't know. We need to refrain from making offhanded comments about something that might be very offensive to someone.
I would be very offended if someone tried to convert me. I feel that my faith is sound. I believe if I was near death and someone felt I needed to be saved in order to go to heaven and they tried to convert me, this would be very hurtful to me, because Jews believe that all righteous people go to heaven, and I would not need to be converted, and I would not welcome that kind of comment nor any kind of literature in that regard.
I'll be really offended if I am offered pork or forced to eat it, because being a Muslim we do not eat pork. And also if someone comments on my veil and mock my veil or my beliefs. I am a Muslim woman and my veil is my identity, and I'm proud to wear it. It's just act of obedience to God.
What are some of the things, panel, that anyone watching this tape, the people who are watching this tape, could do in order to assure that your needs would be met in a healthcare setting?
I think of 2 things right off the bat. One is really just listening. I think many times elderly, especially in our healthcare facilities, have a need to share and to talk. And some of the conversation that they move into is reflecting upon their own faith journey, their own faith story. And in a very non-judgmental way, just to hold that story for them and with them, if they want to talk about it and have somebody hear them out. Maybe where the experience of faith has been very important in their lives. I think the other piece is that oftentimes there are folks that, for whatever reason, are disconnected from any type of religious experience and church tradition and the like. And I think we have to respect that we don't necessarily raise some questions that make others feel uncomfortable, but really respect the fact that their journey of life and their journey with their God is theirs, and they don't have to do certain things, at least according to how I would see things, for their life to be okay. So I think a great deal of respecting somebody where they have lived and what they've experienced.
I think the nursing assistant could help me more in the physical way, that she or he would assist me in obtaining the things I needed to pray. For example, my prayer book, my glasses. If I was a man, I would need my prayer shawl and a head covering. I would also want to be with my community, if that was down the hall in a meeting room, or if there was a synagogue attached to the facility. That nurse's aide would need to help me remember perhaps what time it was, and to make sure I actually got to those services and was able to enjoy them and worship together with the other members. Those things would be very important. Again, I think that being respectful of my tradition, and also realizing that it's going to be something time related too, Friday nights and through Saturday versus a Sunday service, and it would not perhaps be in the regular rhythm of the facility. It might be a different rhythm.
I think I want the caregivers to understand where I stand as far as my religion goes, and also respect all the beliefs, not only Islamic beliefs. We can get along, we can be together with our different beliefs, and we have to respect other people, and that's how I think we can be respected. If we can respect other people, we should not enforce our beliefs on other people.
I hear a common theme running through all of your discussion, and that seems to be respect. It's very important to each of you that your faith tradition is respected by those who take care of you. Would you agree with that, panel?
Yes.
By all means.
Any other comments that you wish to make?
I would like to comment on that, like Muslim female or male, we want to be taken care of by same sex. Like I'm a female, and if I go to hospital, I would like to have a female doctor, female nurse, or any technician who's female. But if there's a need that there's no female available, then I can be taken care by a male doctor. But it's prefer to have a female doctor. And same with men, Muslim men. It will help if they have male doctor or male nurse.
So if you were in a healthcare facility then and there was a male nursing assistant, you would certainly much prefer
Female.
that they work around that,
Yes.
so that you can have a female nursing
Absolutely.
assistant for that particular, for those care issues.
Yes, in fact my sister recently went to hospital for 3 days, and we told the facilities that we do not want any male, if possible, to take care of her, and they respected our beliefs. And we really appreciate that.
I would say that I think the importance of being able to pray with somebody is something to be realized. Sometimes somebody might want to not necessarily pray with the chaplain, but but want to pray with the nursing assistant or even the housekeeper that's right there at the time. And if you feel comfortable doing that, and if you work for a company that will allow you to do that, meet that need at that time, because it might be a very important one that will fulfill something for that person at the time.
And I think if you're not able to meet that need, perhaps the nursing assistant could refer the patient or the client to the nurse, who would be able to give a complete spiritual assessment and refer that client to the appropriate clergy or facility or perhaps organization to meet those spiritual needs.
Absolutely. Need to know the resources that are available and be able to refer to those and tap into those resources. Any other comments? Would you say that then for you a quiet place to pray is
Yes.
important? For people to be respectful of your dress
Yes,
and
absolutely.
the role of the female in your religion.
Yes.
Any other important points?
There's a stereotype here that many people think that a female who wears her veil is oppressed. This is not the case. My father or my brother, no one tells me to do it. It's just act of obedience to God, and I think that should be understood. And I don't need any pity for wearing this. I don't want anyone to come to me and say, "Oh my God, you have to wear this, don't you feel hurt?" No, I do not. I'm proud of it.
And Deborah, to sum up, what you would say would be Sabbath is very important, praying is very important, food, dietary considerations.
I'd like to add that there is a wide spectrum of religious observance within Judaism, ranging from the most liberal to probably fundamental or orthodox. So there would be a wide range of adherence to these practices. But and I would also mention again that there is a different cycle of holidays and a different schedule for the Sabbath that is different than the larger culture or our American culture that we live in.
John?
I think in a lot of healthcare facilities these days there's also a good spirit of ecumenism, at least among Christians, Lutherans, Catholics, Episcopalians praying together, and I think that can be helpful in a healthcare setting too.
Thank you, panel, for your very helpful comments and insights today. This concludes our session on meeting spiritual needs. I would urge you to remember that as nursing assistants, you are at the bedside, and therefore you are in a very unique position to be able to play an important role in meeting the spiritual needs of the residents that you care for. I trust that you will take this responsibility very seriously.